Local record. Questions. Okay. It says you are live. Let's
We're live.
see.
Do I gotta accept anything on face or no?
Yeah, let me get this. Let me see. Oh shoot. Oh, that was quick.
I gotta
Okay.
accept.
Yeah, I'm about to
Alright.
tag you right now. What up, y'all? Pull up on us. I'm gonna tag you right now. You can have this. And then once you accept it, then the people on your page will be able to see it. So I just did it. Hey y'all, what's going on? Here we go. Did you see you?
Boom. Okay. It just was to add to profile, right?
Yep, that's it.
Yep. Boom. We're in here.
Oh, let me find out. This is streamlined a little bit. So listen, I tell this whole story like at the beginning when I go merge from Facebook to Zoom, it's all of the things. It's to make it public. Hold on, let me make it public too, because that I may need to do that. So if I make it public, then other people can share it. Let me see. Now it's public. Okay. We have finished thing. Let us know you can hear us. Let us know you can feel us. Okay. We need to know all of the things. What's going on, y'all? Happy Sunday. We in the building. I have been waiting. You and I have been communicating.
Yes. Yes.
Excited about this conversation. Howdy.
Yes.
Hey, Clint. Hey, happy Sunday. Cool. Can you see? So hold on. Let me see. Let me see. Oh, do you see it? You see it? You see
Yep.
it?
I see it. I see
Come on. We got you in the building, Clint.
it.
Clint, I was telling them this is a new platform that I'm using, and Cherish gets to be the recipient of
Hey.
however it chooses to show up. Okay. I've had some hiccups earlier, but he on here, he saw us. What's good?
Told you
Let's
this is raw. It's gonna be okay.
this is raw, baby. The questions is coming. I'm so excited. It's on your page, so your friends should be able to see it. You accepted it to your profile. If we need to do anything different, just let me know. But let's jump into it. It's about to be a conversation.
Yes, ma'am. Yes, ma'am.
Who I think I texted you maybe the other day and was like with the studying and all this, like I was a little overwhelmed by this topic. And that lets me know that it's a topic that we needed to discuss. So thank you for your yes. Let's get into it. Listen, welcome to Road to Recovery. We talk addiction and we talk mental health. I'm your host. I am Erika Genice. I have dope conversations with dope people. This is what I do. This is what I love. This is what I breathe. This is what God purposed me for. The purpose of this platform is to inspire and motivate people to improve their relationship with self. I think the best relationship you can have in the world is the relationship with yourself. And joining me today, I have Cherish Torrence.
You said it right. You said it right.
Listen, I told her
You got it
the
right.
fact that I think this a whole tongue twister and it ain't. So if you see me struggling, I'm finna hit her with the CT, okay? Because that's gonna be
There you
easier.
go.
But Cherish, thank you so much. We have Cherish, she is a registered nurse for 11 years. And for the past 5 years, she has specialized in the mental health field. She obtained her master's in science in nursing. Hold on, boop. She obtained her master's of science in nursing. Currently, she's employed at the state mental health hospital in Wisconsin as a psychiatric nurse. I'm fooling it all up,
You're
but you get
good.
it. And she recently, which she told me, which I'm super excited for. So
Yeah.
thank you. That she is pursuing her doctorate in nursing, which is
Nursing practice, yes.
super dope. Super
Yeah,
dope.
fingers crossed, fingers crossed. Slip
Nah,
and slide.
you good. And so I'm super excited for your yes. I'm super excited for you to be here. This conversation is gonna be heavy, but absolutely need it. Is there anything about your intro that you feel like I missed out and that you want to add into?
Not much, but it's a psychiatric nurse practitioner.
Okay.
In Wisconsin, they consider us psychiatric nurse prescribers, but
Okay.
it depends on what state is either a nurse practitioner or it's a nurse prescriber.
Okay.
Yep.
Either way, you qualify for this conversation. Let's get it. And let's not forget, I always have to shout out our dope audience members, our dope family. Thank you guys for being here. Let me know what city you're tuning in from, and throw out a blue heart. I want a blue heart in just a moment of love for people who are either struggling from addiction and mental health, or just mental health, or just throw out a heart because we just love people just in general. And I literally want to see all that love. So throw out the hearts, throw out the blue hearts. Don't know if I'm gonna be able to see it on this platform. Like I would be able to see it on Facebook. We'll see, hopefully, but throw out the blue hearts. Let's start with a quote. Oh, I see. Oh, okay. They're coming in. Thank you so much. We got Frisco, Texas in the building, throwing out a heart. We have blue hearts. Thank you, Shayla. We want to spread the love and let people know that one, we're in unity, and two, you're unjudged on this platform and forever. So thank y'all so much. Okay, let's start out with a quote. The worst part about the worst part about nope, we're going straight to the game. I told you that the devil was finna be busy.
We're not gonna let them do this. We're gonna spread the word like we said.
Listen, I ain't never had no issues with no quote. My internet went out before my live. I feel it.
Yeah, they don't want us to talk about this.
Period. I'll put a quote in here afterwards. We finna keep moving. Let's get it. Let's go to the game. You got your cards? You got your yes card?
Yeah, I got my yes, and my girl, no ma'am. Yep, I got
no ma'am. Okay.
Yeah,
all right, let's go. The audience members know how we play this game. If I'm gonna read some statements that I've heard over the years, right, that pertains to either mental health or addiction, and you will let me know, and you'll hold out a card. Audience members, I can't see your cards, but you can still play with us. And if you are in agreement, you say yes and you hold it up. Or if you're not in agreement, you say no, ma'am. And if you need to jump in to explain, you can. If not, we can just keep it moving. It's up to you.
Gotcha.
Okay. The first statement: relapse is a sign of failure.
Girl, no ma'am.
Okay. Drug abusers could quit if they really wanted to. Okay. If you can still do your job, that proves that you're not an addict.
No ma'am.
Okay. The first step towards recovery is being honest with yourself. Addiction is a choice that people make.
I don't say that much, but no ma'am.
Okay. And lastly, people struggling with addiction don't care about the people around them that this may affect.
I'm gonna say no ma'am to that. I think with this, the only reason I'm gonna explain this is because I don't think that they don't care. I think that they're just so in tune with what's going on with their mind is just going on what they want, and that's kind of what it is. Because we find that after, when they go through the whole, when they're going through like the relapsing, or when they're going through the programs and stuff, that they have that guilt, they have that hurt because they didn't want to hurt that person, but it's just that in their mind, the addiction, whatever substance was, that's what their mind wanted at the time. So I would say, girl, no ma'am to that one.
Okay.
But we'll talk more about that as time goes.
Absolutely.
Yeah.
Let's jump right into it. What would you, how do you define an addiction?
So when you think of addiction, you think of dependency. This is a person that uses substance knowing the negative consequences from it. So you still use knowing that they have these consequences, but your mind is already fixated on this drug, whether it's alcohol, whether it's meth or cocaine or opiate pills or whatnot. It's something that you think of as chronic, and it is, like I said, it is treatable. But it is something that is like you're fixated on it, like you need it to survive. That's what your brain at least tells you.
Yeah.
So
yeah. What are some signs that a person can recognize in themselves or maybe other people? But let's just focus on themselves. What is some signs that a person can recognize to say, "Ooh, either this is an addiction or it's getting really close to codependency"?
what I found was, and especially like with my patients, some patients, they don't know, they don't see what we see. You're so wrapped in it, you're not seeing that you're deteriorating, whether it's by not keeping up with your hygiene. They'll admit though that they would like use all their money just to get this fix that they need.
Yeah.
So then on the outside, we're seeing like, hey, you never have money anymore. You don't want to do the things you like to do anymore. You're starting to hide things and be a little sneaky with things. You're starting to get weight loss. You're not eating, you're not sleeping. So you start to see all those signs, like from the normal routine of things, you start to see them kind of deteriorate that way. Whether it's from, skin start drying out, the yellowing of the eyes with people who drink excessively, then it's like the jaundice, it affects the liver. When people say their vision is going, that's alcohol in itself. You get the numbing of the legs, that's alcohol right there too. Or in some cases, you might start to see that the person's starting to get paranoid, which is out of the normal. Now, the paranoia can be a mental illness or it can be a substance use, but if they typically have a history of substance use, then most likely that's probably what it is. Because some medications like methamphetamine, you start to hallucinate and you get paranoid. And after a while, even after stopping it, you still have that paranoia for a period of time, sometimes weeks. So those are some signs that, family members could probably, see. But a lot of times people who use substances, they try to hide it from their family, especially if they have an addiction. Alcohol is the easiest to do.
Yeah. So shout out to we have Lois here. She throws
Oh, my
out
mother.
names.
My
Hey,
mother.
hey,
Cherish,
Lois.
my
We
mother,
have
yeah.
Rachel Ray, which is a mutual cousin of ours.
Found that out, yeah.
I know. And we have Barbara Burzon, which is my mom. Hold on, moms.
Mom's coming through.
I'm gonna come through. Hi guys. Thank you, fam bam. What's up, Rachel? So let's here's another question. And it's something that I wanted to add in here because I think sometimes when we think about substance abuse and any sort of mental health, we're very hard on the person. And so I want you to tell us, what are some beautiful things about a person that is an addict or a person that suffers from mental health? What are some beautiful qualities about them?
Ooh, beautiful qualities about the person.
Yeah.
I guess it just depends on the person.
Yeah.
I guess really, just know that the person, they're still people. They're still the person that you knew before the addiction. I'll say that.
Yeah.
But the addiction part of it, just know that that person's suffering. That's a person who is struggling. They may not know it while they're in it, but typically they knew once they come out of it that they were in a state that they thought was helping them, but really it wasn't helping them. You got to think a person who's addicted, the medication swaps out all the good desires and things that they want to do in the brain for the med. So it's kind of like in your mind, like the desires that you want and the things that you like to do, you don't like to do anymore because now your mind is just set on this med, on
Yeah.
this drug. And I do want to clarify that addiction doesn't have to just be medications. It doesn't have to be like alcohol. It can be sex. It
Yeah.
can be another person. It can be food. It can be you're addicted to work. Whatever the addiction is, addiction in itself is just not good. It's a dangerous thing because you got a person whose brain, that's all they want. And they don't look at anything else because that's what they want. So I guess the beautiful part about a person would be that person is still that person. It's just that they're in a bad spot right now that, they need to come out of to be the other person that they were. So
yeah, even
what
when
I say.
of course, researching this topic, there was a man, I don't recall his name, but his addiction was to classical music. And every time he said it, people were like, what? How? And he was a doctor. And he used to leave his patients and the job just to go buy another classical tape or a CD or whatever, a vinyl. And he spent thousands of dollars a day. It ruined his marriage. It ruined his relationship with kids. And so when you think about addiction, we're very kind of narrow-minded in the sense of we're thinking it's only drugs and alcohol and sex. And we hear about, sex addictions too, but there's so many other addictions where we can get into people addicted to tennis shoes and to shopping, anything that you feel like if I don't do this, it's a problem, right? I have to, and I'm willing to spend X amount of money, my last dollar, just to have this fix and just to have this high. So thank you for pointing that out, that it's not just about alcohol. It's not just about drugs. It could be work, by the way, too. I'm addicted to my kids. I'm addicted to my marriage. Anything you can go a little bit too far in, right?
Right. Yes.
So thank you for pointing it out. So let's go to the next. Let me see. Oh, here we go, bam. We got that one in there. I'm trying to make sure that I'm highlighting all of the comments that are coming in. Listen, we have 11 people that's watching right now, 6 people that have reacted to this. Like I said, this is a different platform for us. And so how I normally would see it on Facebook, I can't really see it right now. So thank you guys for tuning in. If you can at least share this video, love it. And one, let us know where you're tuning in from. And also if you can give us a blue heart in support of anyone, even if it's yourself, that's struggling from any sort of addiction or mental health. In your profession that you've been in for 11 years, what are some of the patients that you see? What are some of the struggles that you are either maybe surprised by or not so surprised by?
Well, working at the state mental hospital, I'll say I'm not surprised at all anymore. The hospital I work at is an involuntary hospital, so meaning we service all the counties in Wisconsin. So typically the patients that come to us are the county felt they were a danger to themselves or others. So it's a whole legal process where you got to go to court and I got to testify that they need to be in a locked mental inpatient facility. But we see everything, every type of mental illness you can think of. I work with people who have OCD, depression, anxiety, PTSD, from personality disorders. We have autism, learning disabilities that come in, but they're coming in because they're aggressive. I see drug-induced psychosis, where they're using these substances that make them seem as if they have a mental illness, but really it's the drugs that's causing it. Alcohol use disorder severe. Wisconsin's known for our drinking. We get a lot of that. Where my hospital is located is up north, the northern part of Wisconsin. So we see a lot of methamphetamine induced disorders and cocaine use. So I see it all. I'm on a unit where it's dual. So I see not only AODA things, but I'll see mental illness. So I work with both.
So have you seen that different substances causes different reactions? Or is it just like if you met someone that was on meth, you can automatically say, yeah, this is probably what they're struggling from, or if they're on alcohol and abusing it, you can kind of tell, or is it just, it varies per person?
I think it kind of varies per person, but typically we see people who come in with meth, they're hallucinating. They feel good. They're elevated. Their moods and how they react to things are elevated. They're kind of very disorganized and also, but then too, they're paranoid. They're very anxious and they're very guarded. People who come in with alcohol, usually, a typical person who's going through, who's intoxicated.
Yeah.
They're lucid, they're slurred speech, they're not being able to have a conversation with you, they're angry. It depends on what liquor they drank, they're pissed off, that sense. It's the withdrawals that you see when they come in from us that we typically see. Typically, when they come to us, they're already in the withdrawal phase. So you see, well, alcohol can be very severe because they can go into seizures, going through withdrawals. And the more that you withdraw from alcohol, the higher the chance of you having a seizure. A lot of people don't know that. Then two, it can get so severe you start to hallucinate when you're withdrawing. And then you get like this delirium where you're disoriented and you're just talking nonsensically, meaning you're not making sense. And it's a severe thing. With meth, typically when they come down from it, they're very agitated because you're so elevated and you feel like you're on, you feel like you're Superwoman, or Superman. But once you come down, you're very agitated and just pissed off all the time. Anxiety is really big. So it just depends on the substance. It depends on how long they've been using the substance. It just all depends.
Yeah. Let's talk about when addiction and mental health collide.
Ooh, yes.
So, would you say that most people that are addicted to something is suffering from some sort of mental health disorder? Are they mutually inclusive, exclusive? How does that work? Because when I was doing, of course, hours and hours of reading on this topic, I've learned so much. And it appears that we treat addiction as just its own thing, and then mental health is its own thing. But it appears that they are kind of inclusive of each other. Is that true? Do you agree with that? Let's dive a little bit deeper in just dual diagnosis.
Yeah, that's definitely true. Most people who suffer from some form of addiction usually have something underlying going on, whether it's PTSD, whether it's depression, anxiety, whether it's some trauma, especially childhood trauma. That's the reason they go to these substances. And then there's some people that never had like a depression, anxiety, or anything, and they just do these substances just recreational with friends, but then they become addicted because first they abuse it, and then the abuse turns into addiction. And then from there, now they're creating a mental illness. So, for example, let's use everyone else drinking. That's the most common thing everyone does. A person who's depressed is more likely to be alcoholic because they're trying to, the alcohol kind of masks or kind of stops the symptoms that they're having of the depression. For example, like when a person's depressed, they're anxious, they can't sleep typically. They're like kind of, their affect is kind of sullen, meaning that they're really like flat and just depressed. And so what they do is to help with their anxiety and their feelings and everything, they drink. Well, the problem is with the alcohol, it helps you to sleep, but the problem is alcohol in itself is a depressant. So it's making you more depressed, even though the person thinks that it's helping. It's not. And so you find that you're in this repeated like cycle. And so that's when you see when people who are withdrawing from alcohol, you notice once they're off the alcohol, they can't sleep still because their bodies got so used to the alcohol helping them to sleep. So typically, not only are those patients usually on antidepressants, they're also on sleep aid meds too to help them sleep because they can't. But then too, a person who, like I said, a person can be drinking with friends and then you drinking a lot. You notice that you may not have no underlying depression, but then you start to feel depressed. Again, alcohol is like a depressant. So it's like substances can cause mental illness, or your mental illness and you drink, it just makes it worse. So they're really connected.
Yeah. Oh, it's so deep.
It is.
So, I mean, we can go so many angles with this.
You can. You're gonna need a part 2, 3, and 4 for this.
Oh my God. Because I think that each drug of choice can have its own sort of breakdown. Right. And even when I was talking to you and you were like, so it's different symptoms, it's different this, alcohol causes this versus other drugs don't cause that, but they cause this other thing. And
Yeah.
so they're all just kind of their own beast. How much of this do you feel like has to do with um, childhood trauma or what you may have witnessed growing up? So I have another part to that is if you've seen your parents or a caregiver have some sort of substance abuse, does that make you more susceptible to it?
Yeah. Like I said, some patients I found, they typically they say, and studies have shown this, if you have a parent
Yeah.
or a close relative who is addicted to some type of substance, you're typically going to be addicted to something. And they can go as far as saying it's a genetic gene that
Yeah.
triggers that. Where one of your siblings are going to have some type of form of addiction, and that can be like we said, anything.
Yeah.
Um, but definitely for sure, it's not a taught thing, but you grow up, you see things,
Yeah.
and you're like, oh, okay, well, that's all I've known growing up. All this stems again from your childhood. As kids, we're sponges. I mean, even now, like we can not talk about like addiction and say like normal routines us as women do. Like we see our mother cleaning, the house every Sunday.
Yeah.
When we get older, I'm gonna clean my house every Sunday because my
Yes.
mother cleaned the house every Sunday. So it's
Yeah.
just kind of like how it is. If you're living in an environment where drugs is common, you're typically starting at teenage years doing drugs, because that's what my mom them do it. My sisters them do it. They good. They feel great. Like I want to try it, and that's where it starts at.
Yeah. Yeah. And if they did it, it must have been okay.
Yeah. I
Right.
mean, I have a few patients that came in and said, hey, my mom has smoked weed since she was, since I was younger. I used to
Yeah.
smoke with her, or, hey, my friends do it. So, I do it, ever since I was a kid. So a lot of people, when you ask them how long you've been drinking, they'll say, hey, from teenage years.
Yeah.
And now they're 40 years old and now they have this addiction, they're alcoholics. And so,
Yeah.
yeah.
What what do you feel like man, would be the biggest reason for a person not to want to get help when it comes to let's just say addiction, because mental health is just like its own thing. So what would make a person say I just don't want to get help or not recognizing the signs? Like what is kind of like the apprehension? Because you think about it, like statistics has shown, like most people aren't really getting treated for these things. They're kind of just moving around in life, and it has to be something major happen, right? In order for people to say, okay, let me go get some
Yeah.
treatment or whatever. I don't know. I'm not everyone.
Typically, yeah, that's
Yeah.
how it should go, right? Yeah.
Yeah. So like,
Um,
what's the apprehension behind it?
Well, I think one of it is resources, knowing where to get help, how to get help. Is my insurance going to cover this? Two, I think it's support, lack of support. I think a lot of, I have a few patients that have come in and, they don't have the support from their family anymore because they didn't
Yeah.
deplete it out, they burned those bridges. Family is frustrated, they're tired. So they kind of like, well, forget it, I give up.
Yeah.
Another, I had a couple patients tell me that they didn't want to go through the withdrawal process because they were scared. And so
Mm,
they just keep doing it because they don't want to feel how it feels without it. And then two, they don't want to feel how it feels without the med because they're using the med to hide whatever is going on with them. They don't want to
mm,
feel the guilt of everything that they did on the substances. Um, but I think a lot of it is like, just education about it, the resources. I know there's patients that come in and they want the help. It's just
yeah.
that either they don't have the funding for it, insurances don't cover it, they don't know where to get the help. So it's that factor too. It's a fear thing. And then you got the patients that don't think nothing is wrong because they're so wrapped in it. They think they're fine. This is normal life for me. I'm good.
Yeah.
And the outside looking in, they're not. So
Yeah. Let's talk treatments. Let's
yeah.
talk what and maybe are treatments different from if you were treating somebody from alcoholism versus drugs versus a shopping addiction? Like what does treatment look like? And maybe let's break down the treatments per maybe a couple different things. If somebody
Okay.
was struggling from, just say, a shopping addiction, right?
Okay.
What do you feel like treatment would be for that?
That would probably be more therapy than anything.
Okay.
There's not really a set med unless they have like that OCD component of everything, and then you might can treat it with like a antidepressant. Some antidepressants can help with like the OCD factor of
Yeah.
things, or if they have anxiety. Really, when you get to meds, you're treating the symptoms. So it's not really nothing like we would have to see the symptoms of the person. So if you're a person that, hey, you have a shopping addiction and you get really anxious if you don't or something like that, then you
Yeah.
might want to get like on an anxiolytic medication to help with anxiety. But
Yeah.
typically you want to change the mindset of the person, really, and that'll be like the cognitive behavioral therapies and stuff like that.
Oh, we were about to
um,
dive into that. Let's get it.
yeah, so with that would be like more so therapy. Now if you're talking about, like, let's say
Yeah.
alcohol, there is medication that can help. It helps. So we have a medication called Camprol, and
Okay.
there's also naltrexone. Naltrexone is one med, and then the injection form of it for some people that don't like taking meds every day is
Yeah.
Vivitrol.
Yeah.
So with that, Camprol helps with like the alcohol cravings. The downside to that is a lot of people, you usually typically do two tablets 3 times a day. A lot of people don't have time for that. They don't really like to do that, but it
Ooh.
does kind of curb those cravings. Now,
Yeah.
Trexone works by stopping the pleasure of wanting to drink. So it helps you drink less. So if I'm drinking, it's like, okay, geez, like this isn't even, it's not doing what it wants to. Like, I don't feel anything from this. It's like blah. And
Yeah.
typically you stop drinking. So that's why we'll prescribe both of them, because studies show both together works best for someone to abstain from drinking alcohol.
Yeah.
Um, but like opiates and stuff like that, if you're addicted to opiates, naltrexone is another medication. Like we use that for opiates as well. They also, studies have shown that it also helps with people who use meth, and also the antidepressant bupropion also helps with meth users as well. But again, that's just the medication part.
Yeah.
Now the biggest piece, like you said, we talk about the cognitive behavioral
Yeah.
therapy piece.
I
So
love it. I'm just gonna
yeah,
go just because I want to experience it. Like
yeah,
just reading it is, can you talk to the people about cognitive behavioral therapy? Like I thought it was incredible. Uh
yeah, yeah.
have you tried it? Have you witnessed it or anything? I thought it was dope.
Oh, I've been into some therapy sessions. We have some dope psychologists that
Yeah.
work where I work, and I've kind of sat and got to listen to or see how you talk through it,
Yeah.
what they talk about, and
Yeah.
really cognitive behavioral therapy is just getting the person to realize their negative thoughts and
Yeah.
trying
Changing of the
to work
mind.
on those thoughts to kind of change those thoughts so that whatever you're doing isn't reoccurring.
Yeah.
So a lot of times you're doing these assignments where you're probably doing things like journaling is big, especially in our program, the
Yeah.
dual diagnosis program, where we have our patients that are in the AODA program journal like their feelings, their emotions, and break it down so that they can see throughout time how, it's improving. For
Yeah.
example, it might be, okay, hey, I feel like this day. Why do I feel this way? And then in the last section of it would be like, what did I do with how I was feeling? So
Yeah.
that's kind of what it's just working on, whatever underlying like what's going on. You're digging that out, and then okay, how are we going to work on this? Because you see this now. What are your triggers? And
Yeah.
learning about your triggers and knowing what to do with those triggers and how to get through them. Really.
Yeah, it's
Um,
the changing, it's changing your mindset, right? Like even when
yep.
I was researching like what is it good for? It was like good for everything. It was
Hmm.
good for depression, it was good for
Yep.
anxiety, it was good for overcoming grief,
Yep.
overcoming a breakup, like because really
Yep.
it changes your whole mind. I'm about to take a
Yep.
session. I'm gonna reach out to my
Yes. Yes.
is are people specialized in it, or is it just like your therapist probably can put you through the same regimen? Do you know?
You can definitely get training in it.
Okay.
Because there's different types of therapies and stuff like that. Like
Yeah, yeah,
we can
yeah.
do some of it as nurse practitioners. We reviewed it and stuff like that.
Yeah.
But to really deep, like we can do some of the tools that they offer. But to really dig deep down, I definitely would go to like a psychologist for that. They're great at that. That's their specialty. That's their go-to. I
Yeah.
refer all my patients that are definitely in the AODA to work with them, because it's not only just a medication piece. You need that therapy as well.
Yeah.
So when you're going through, your detoxing and you're going through these programs, you definitely want a program that is going to work on not only the medications you need, if you need medications, but most of the time you do because you have underlying something going on.
Yeah.
then the therapy, but also the program as well. You need those three components to really be successful. So,
Okay. So I have two messages that came in while you were
oh
talking.
yeah, awesome. Oh
So
boy.
not on here, they texted me,
Okay.
and one of them said, "I'm addicted to weed, I think. Is it okay if I smoke weed every day?"
Okay. So
That was it. That
let's
was the question, by the way.
okay.
I don't have no
No,
other
no, no,
info.
no, no, no.
I asked you
I can
yet.
go so
Okay.
many ways with this.
Okay, go
So
wherever. Let's get it.
so marijuana. A lot of people, marijuana can cause depression. Just flat out there, it causes depression. It messes with your central nervous system, basically.
Okay.
So it can cause depression, anxiety. It can cause paranoia, and in excessive uses, like it changes the chemical balances of your brain. Some people actually can get addicted to weed. People think that you can't, but you definitely can. Well, marijuana, but slang terms, weed.
Yeah.
So some people really can, especially if you feel like you're craving it, or you need it every day. That's a form of some type of dependency. Like, oh, I need to smoke. Oh, I need to, that's dependency right there. Now you're not doing it for recreation. You're doing it because you feel like you need it.
Yeah.
What a lot of people don't know about marijuana is too that you can go through withdrawals from marijuana. When you get crabby, when you're cranky, when you're just restless, those are withdrawal symptoms. Because if it goes away once you smoke marijuana, then that must mean, okay, I was going through a little withdrawal
Mm,
and now it's gone because I didn't smoke and now I'm calm.
yeah.
Now that's why a lot of states are struggling with making it legal.
Mhm.
Like I know Illinois, especially, they have the dispensaries and stuff. That's great, but it also too, like I said, it changes the chemicals in the brain. So typically, people who smoke marijuana, studies have shown, are typically depressed. They're anxious, and most of them are like paranoid.
Hey, Rachel said, "This is so good. I pray for everyone dealing with mental health issues and addiction is delivered from it." Thank you, Rachel.
Yes, yes, yes.
Thank you. Um, okay. The other question was, I go to the casinos a lot because I really love it and it helps. It's fun for me. Can I
Okay.
possibly be addicted to winning and losing? However you want to take that.
Mm,
Can
I guess
gambling, let's just say,
gambling,
can that be
gambling.
addiction?
It's in the DSM-5 book, which is our mental health book of the different diagnoses. So gambling is a diagnosis that we can diagnose. It just depends, though. It depends on, are you losing your house from it? Are you not feeding your kids from it?
Mm,
Are you not washing your butt because you got to go down to the casino? Are you not going to work because of it? That's when it becomes a problem. Now, if you like to do it to have fun and get money, sometimes you lose and you don't, but you're still being able to do the things you do on day-to-day life, then
yeah,
I wouldn't consider that as like an addiction. I consider that as like a recreational thing. That's what you like to do. That's your passion. You like to gamble. I know people that do that, but they still can manage day-to-day things and it not affect like things they need to do. They're not going negative balance just to go to the casino. It's not like a need or a have to. It's just because, hey, I want to, and that's what I do. So I
yeah.
think that's a difference in a way, if that makes sense. I don't know if that makes sense for the person.
So it's a need versus I want to
Correct.
is a good way. I like that though, because that's
Yeah,
clear.
like I need, it's just that like, oh, I need it. Like I need it. When you feel like, and you're, yeah, when your mind already says like, hey, I need this to survive,
Yeah.
then it's kind of like, yeah, you're going a little bit far.
So here's a question, just off the top.
Mm.
What would you consider a functional addict? Like if someone did, this is about to be extreme, but I don't know how else to like illustrate it. If
Yeah.
someone did meth once a day, went to work, life is good, maybe it wasn't regimented with the times, but they just did meth once a day, maybe screw it, once a couple times a week. Does the drug matter? Or would you still say, so if you had a friend that did meth, if you called me today and I was doing meth, and then for the rest of the week I'm working out, I'm doing fine, but it just was kind of fun to me. Is that an addiction because of the type of drug? Are there some drugs that you're like absolutely stay away from those because of whatever? what would be something functioning for you that you're like, okay, she do meth a couple times a week, so who cares? Okay. You
Yeah,
ain't
I ain't going with that. Meth, no.
the setup.
We're
I
not
had
doing
to
that.
set up.
We're
I
not.
was trying to do
Nah,
it.
you set me up really good. Nah, it sounded great at first. I'm like, whoa,
Oh my
okay,
God,
yeah.
I had
And
it.
then you
I
just
had it.
start. Nah, I'm
Like
not gonna
you
go with that one.
girl, what you doing? Just a little meth? Ain't nothing. What's popping? It's Saturday. No, Sunday.
Nah,
Sunday. No?
no. Only reason is because not with meth. Any drug, I don't really condone any drug. I mean, the most common drug that we use is alcohol, you know.
Yeah.
But in a sense, like, it's a difference between addiction, is a difference in abuse. Abuse is using something more than you should be. Addiction is when now the abuse has gone too far to where now you need it, you know, and you want it. So with meth, I would say, hey, you shouldn't be using that, because even if you try to microdose or micromanage, as you say, one is illegal. Let's go there. So I'm not going to condone it. But
Okay.
then two is messing with your brain cells. It doesn't matter how much you use of it, it's messing with your brain cells to the point where people who use stuff like this, they can put themselves into Parkinson's disease. You know, it really messes with the chemicals of the brain. So a little meth, no. A little cocaine, no.
So,
You shouldn't be dipping
meth,
and dabbing
no.
with any of that, because
Cocaine,
sometimes,
no. Weed,
no.
are you okay with a little bit of?
Listen, I have.
Hey,
Right,
little
look,
weed.
I know some people who
Sunday,
smoke.
Sunday
Okay,
weed, no. I'm
I
trying
know
to
some
figure
people
out
who
what
smoke.
we gotta draw a
I
line
mean,
in the sand for y'all. What
hey,
are
I
is there
can't
any
I
drugs
can't
that
condone
you
any of it, really.
is there any
I just
drugs
I
that you
the
said
professional the drug alcohol. You know, there's nothing wrong with getting a little wine here and there because you had a
okay,
stressful day, because, you know, whatever, if that's what you use, just, you know, I'm not saying all the time drink wine, but there's
yeah,
nothing wrong with a little bit of wine, you know,
right.
or alcohol in itself. You know, it's a recreational thing, it's legal, you know. Marijuana, it depends. Like, you know, I it to be honest with you, I tell my patients, like, if you're gonna smoke, because I can't stop people from smoking weed, you
Yeah.
know, they feel like, hey, I'm gonna smoke regardless. I just say, if you're gonna do it, get it from a dispensary. At least you know it's kind of it's regulated. If you start to get different dealers and stuff out here, that's when you start to get like the K2, and you start to get those other mixtures that I get people that come in smoking something like these. I had a couple patients come in, college students, you know, and they come in and they didn't smoke whatever marijuana they didn't got, and now they're psychotic to a point where some of them don't come back to being themselves for months and months on end. You
Yeah.
know, we got to put them on antipsychotics because they got this bad batch of weed. So it's that sense too. So I always say, hey, if y'all gonna do it, my first question is, hey, where do you get it from? I'm not gonna tell you that. I don't care who your dealer is. I'm not saying tell me who he is or her. I'm just saying, where do you get it from? Do you get it from dealer, or you get a dispensary? At least a dispensary is regulated in some sense.
Yeah.
So in that case, yeah, I guess so, because it's legal in some states. But the
Yeah.
meth, the cocaine, the mushrooms, the ketamine, the all that, nah, nope.
Horace Town says take gummies, but we ain't on it.
And
That,
that's even
that's
worse, because you don't know
that's
when it's gonna
okay.
hit you, and
We
it's
don't
that's
know.
even worse. So no, no gummies
Sorry,
either.
sorry, Horace. Listen, we killing all y'all fun. Y'all thought it was sweet out
The
here.
professional in me. Oh, I hope none of the doctors are. I hope they're proud of me at this moment. Yeah, my job are probably watching this. Hi, docs.
Hey, docs. Um, so treatment. Did we talk treatments like specific? What does treatment centers look like for people who are ready for recovery, who are thinking about making a recovery? Let's give them practical steps that they can take to get well.
Well, I guess first thing is recognizing, hey, I need to change. That's the biggest thing. But then two, just know when you go in these programs, it's not going to be easy.
Yeah.
It's grueling. It's you're going to get frustrated. You're going to go through. You're going to have some symptoms. You're going to be agitated. You're going to be pissed off, because you got to think, a lot of people who go into treatment facilities, they have not been sober for a day. Some people haven't been sober for an hour. So
Yeah.
to be sober for 30 days, 90 days, 6 months, that's hard for a lot of people to do, because your body is so used to it. That's what you want to do.
Yeah.
And so you're going to have all those symptoms from agitation. You're going to be restless. You're not going to be able to sleep, anger. Then that's when you're sober, that's when the guilt set in. that's when you're really emotional. That's when everything hits you and you feel like a failure. And just know that it gets better. You got to go through the steps. You got to go through the process. Get a treatment program that's dual, where you're not only inpatient if you can, have your psychologist going through those therapy sessions, because you want to work through whatever was the underlying reason, or the guilt and the shame, or whatever you're feeling. You want to work through that. You want to be on the proper medications, whether that's you seeing an NP or seeing like a doctor that specializes in, mental health treatment. You want to make sure, psychiatrists is what we call them. You want to make sure you're seeing that. And then two, the program that you're in is going to be learning about your substance. It's gonna, what we do at the hospital I'm at, they had our counselors have them do like a rap sheet, to where like what started all this. It's like your own like, paper basically of when did this start? Why did this start? What happened? And then you start with that, and then from there it's like different like sessions and stuff like that, talking about the drug, talking about what it does to the body, talking about different treatments. So it's really just getting to the core of everything. So it's not an easy process, but it's worth it in the end. It really is.
Yeah.
I've seen people, I mean, you just look better. I've seen patients that come in that look like, man, like they were close to death. And then just to see them on, because we have, it's a 5 to 6 week program, but to see them at the 5th week or 6th week, depending on how they do, bright affect, their face, they just look more healthier. Skin isn't as dry anymore. Lips aren't cracked anymore. They're able to think. It's amazing to see how you feel when you don't have that drug in you. So definitely it's a process. Just know it's worth it.
Yeah, give yourself.
It's not easy though.
Yeah, it's that grace.
Give yourself credit. Yep.
Yeah, give yourself credit. Give yourself grace. It is a process. Yep. And I'm glad that you mentioned like there's always an underlining issue. You don't just become an alcoholic or a drug addicted to a drug or addicted to whatever just because, right? Like you didn't just wake up one day and say, you know what? Today is the addict day. This is the day, right? There was something that happened over time. Over time, though, right? And so figuring out, it's that duo, which is why I love the fact that I think that initially I was doing this live on just addiction, and you were very clear that we have to add the component of mental health, because they both are a web, right? Like they just weave together and it's part of it. And you have to be able to get to why. What was the why? And you have to treat that. So you can't just get off alcohol, but don't realize like what the issue was, because you'll relapse or you'll go back.
Yep.
And so you
didn't fix the issue.
You never fix the issue.
Yep.
So we have some questions on here, and I'm actually really glad that Rachel asked this, because this was actually one of my conclusion questions. But let's just go to her question. What if you know someone is addicted to a drug and you try to talk to them about getting help, but they are in denial? What would be the next steps? Well, what would the next steps be?
And it that's tricky, because in order for a person to go and get the help that they have to want to. And as a person that loves that person and supports that person, it's only so much you can really do. And I hate to say it that way, but it's true. When trying to help someone who has an addiction, you want to, well, first, whoever, before helping them, you want to make sure you're good. That's saying that you can't help anyone unless you're able to help yourself. Well, you want to make sure you're good, because dealing with someone who has an addiction or knowing someone that does, it can be very draining, and it can affect your mental health, and then you're not good for you yourself or that person. But the biggest thing is you can help find resources for them. You can keep educating them about it. You can keep you can say, hey, I can set up an appointment with you. You can keep encouraging them, but ultimately it's their decision in the end. You can go as far as getting a team around you, whether getting their friends involved, family involved. If you want, you can try to do like an intervention. Sometimes that helps, but ultimately that person has to be the one to be like, okay, I'm going to go. And then when they do go, you want to be their support and try to help them, go through the process. One thing you really don't want to do is you don't want to enable them either, especially if you know they're they're addicted to something, you don't want to give them money knowing that they're going to go buy meth. I don't care how mad they are, how pissed off they are, how they say you're a horrible person, blah, 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 I need it for this. Don't do it. You don't want to, especially if they're alcohol, if they drink a lot, you don't want to be with them in a club drinking, hey, let's take this shot together, and hey, let's get this bottle, and knowing that they have an addiction, because you're just enabling them. That's good. And another thing is too, you don't want to make them feel bad. I know sometimes they can get frustrated and you just want to yell at them and make them feel like shit and like you're stupid and all. That's the negative, because really what you're doing is you're not only making them want to go do drugs more, you're pushing them away. So it's a hard struggle, but you also want to make sure you have those boundaries too. Don't overexhaust yourself. The person say, hey, I'm good, I don't need that. Back off a little bit and then say, hey, I found this resource. They're gonna get pissed off. Hey, I told you I don't need that or whatever. But again, you can't exhaust yourself either. It's a struggle. It's hard, especially, I'm pretty sure all of us have someone that need to lay off some stuff, but and you love them, so you don't want to give up on them. But at the same time, like, to what expense to your mental health and yourself? Again, it's the person that has to make the change. So
and like Horace said, you can't help anyone who doesn't recognize or accept that they have a problem. And I think that's what we want to do in love, right? We do it in love. Like I have just a history of people in my family who have abused just about anything. And there's certain boundaries that I have in place where I can't go if you're drinking, I can't be around you. Or there's certain places I just can't go. And I think it's setting those healthy boundaries, one for yourself, but also I think sometimes when people start seeing like, I'm literally losing everyone and everything that matters, that can help too. Like, I'm not showing up for you in space anymore. Like, I actually don't want to go out with you anymore. Like, damn, I'm losing everybody.
It's the saying of hitting, it's the saying of hitting rock bottom, basically.
Yeah.
You got to hit the rock bottom.
Yeah. Rachel said, I think the hardest part is the person admitting and acknowledging they have an addiction. Drug and alcohol just mask the issue they're dealing with. Loves how you explained it, Dr. Torrence. You better say doctor.
Right. Put it in the universe, honey. Put it in the universe. Yes, thank you.
We
We're going to put that in the universe.
Yes. I can't wait to call. I'm going to start calling you doctor because it's coming.
I ain't a doc yet. I'm going for it.
Oh, it's coming though. I love your work. I love your work. So Rachel really hit on this question. And I think you pretty much answered it, but my final question essentially was how to support family and friends, right, when they're going through an addiction. And I think you really highlighted it is, one, don't enable them, and don't make them feel, like in your words, like shit, because then the reality of it is they already feel like shit though. Like it's shame, it's embarrassing. They're not doing this because they think they're the cool kid on the block. Like they understand that this is a problem and they don't know what to do. They don't know how to stop it. If they could, most people would. Like, that's how challenging you said, like, even with going through the treatment centers, it's like, it's not easy. And you hear a lot of people. I think my dad was talking about it, like before he got clean and sober, like it was plenty relapses.
Oh yeah. You're going to go through those.
Giving yourself grace. My dad was, he finally was off drug and alcohol for maybe 6 or 7 years now. But he called me the other day and he was saying how he's stopping smoking cigarettes. Like that's his last thing. He like, man, I done went from this. I've got to have something. And he was like, that's not helping me either. And he called me. He said, man, Erika, I had a cigarette today. I ain't smoked in a month. I said, okay. Don't have one tomorrow. Let's go. Let's restart. And he was like, wow, that was just what I needed.
Yep. They need that encouragement. They need that acknowledgement to say, hey, like I seen that you, good job. You know, they need that.
I'm proud of you. It's 1 day. It's 1 day. It's 35, 60, 90 days. I'm proud of you for even making it here. And kudos that it didn't happen. I'm proud of you. Let's go. And so he was like, I restarted, and he hadn't had a cigarette since. But if he calls me today and say he does, okay, let's go. We get to restart. And I think encouraging people that you're not a failure.
Right. You're definitely gonna go through those relapses. You definitely are. I've never seen a person that just went through a program and just was like, okay, I didn't relapse, not at least once. You're going to. I know someone that just told me recently, like, hey, they've been sober from alcohol for 20 some years, but they still have to go to AA meetings.
Yeah.
They still need to go to those, because the thought of a lot of times too, when you are sober for something for so long and abstinent from it, it's easy for you to get addicted to something else. So
Yeah.
that's another thing that can be a whole nother topic in itself. But
Yeah.
you just got to be aware of that too, where, okay, yeah, I haven't drank in 20 years, but if I get on, like, say, some people pain pills or something like that, something happens, they have surgery, you see a lot of people that don't do pain pills, because they know, hey, I have this addiction history with alcohol, and I don't want to get addicted to pain pills, because it's easy. It just is, because your body is still underlying, like, hey, when I get that next thing that feels good, I'm going to
Yeah.
stick on
Yeah.
to that. And
Yeah.
that's why I see a lot of patients that come in, they really will avoid certain meds if they feel like they're going to get addicted to it, because they have that history. So it's just, it's a continuous
Oh yeah.
battle. No
Yeah.
matter if you haven't done it in a while, it's always going to be a continuous battle. Just keep fighting. Just
Yeah.
keep doing what you got to do.
I remember my aunt told me that when she got off of drugs, she moved to NyQuil, and we laughed about it. It was funny, but it was really like, I
Yeah.
need something to make me
Yep.
sleep or just make me feel drugged up or something like that. And she doesn't
Yeah.
do it now, but she said for a long time
Yeah.
after she cut her drug addiction, she went straight to NyQuil
It's just
every night. And
just
so
just replacing one thing from the next. Now
yeah,
you're addicted to NyQuil. Yep.
yeah,
It's
that's what
still the same
Chanel
thing.
said. Yeah, Chanel said so true. From one addiction
Yeah.
to another, and
Yeah.
it's a dangerous game to
Yeah.
be
But
played.
I will say though, Erica, just a fun fact out here for everybody too.
Yeah,
People who stop drinking alcohol, if you notice when they stop, they drink a lot of sugary things. They drink like a lot of juices, they eat a lot of candy, they drink, that's like their hydration is juices. Well, and you see them drink a lot of it. That's because the sugar kind of breaks into like a little bit of alcohol. So still gives the body that
yeah,
feeling that they're drinking alcohol. That's why if you ever notice people who and they drink a lot of juices and stuff, that's what it is. So now you're focused on juices because it breaks down until you feel like you're still drinking, basically.
yeah,
So that's why it's important to know what you're eating, and everything is between your physical and your mental. It all gotta play
yeah.
together.
It's
That's a
that.
fun fact if people didn't know.
I love that. It's the underlying issue.
Underlying issue.
What is it really about? Well, listen, our time is concluding.
It is. Oh, we're
This
just getting into the
we
everything.
did it. Wait, listen. When I
We're getting in it.
we need
I was
part
getting
one.
comfortable.
I know. So my final question, which is always my question that I ask everyone at the end of my lives, is what is one thing that you absolutely love about Cherish? Like Cherish is this is the one thing that can't nobody take, but like this is mine. I love this about me. I don't care what it is. What is one thing?
One thing. Who is multiple things? But one thing.
Oh, come
Multiple
on.
things.
Oh, love that.
I love the fact that I'm diverse. I'm a social butterfly. I will talk to anybody. I can relate to all types of things. Yeah, I would say I like the fact that I'm very diverse and very open, and just, yeah, I love to communicate with people. So when you
Yeah,
have that, I mean, in my profession, you got to know how to talk to people and be open to talking to people and have an open mind to things. So I would say that a lot of people are not social like I am. So I'm like a social butterfly. So I'll
yeah.
say that.
I
I'll
think
say
it's
that.
what connected us though. Like even from the moment that we had a conversation, it was instant chemistry between us. It
Yeah.
was very much, it felt like we grew up together. It's been extremely organic. So I get that about you and I appreciate that. And I'm people that are surrounded by you, I'm sure they would love and say the same thing.
Oh yeah.
The audience members, you already know I'm about to ask y'all. I need everyone that's on this live. I see 10 people. I need 10 answers. What is one thing that y'all absolutely love about yourselves? This ain't just on me and her. Y'all need to say it. I think that we need to tell ourselves more things that we like. And I love the fact that you were very clear, like, oh, you said just one, because I got multiple.
Oh yeah.
Think about people who don't feel that way about themselves. They struggling.
Hey.
Most people, when I ask the question, they like, oh, hold on. Ooh, we should be able to say it, spit it out. This is what I love about me. And if you haven't got to that point, you better figure out how to get there and quick. Let the people know, where can they find you? Where can the people find you?
Oh man, I guess social media really.
Yeah.
Facebook, Cherish Torrence. Instagram, I think it's Cherish underscore and Torrence. But definitely Facebook. Uh, I'm connected to you on your page, so definitely you can message me if you have any questions. If I don't know the answer, hey, I work with some awesome doctors, social workers, LDA counselors. So any questions you have, I definitely can talk with them if I don't know it and get you what you need. So yeah.
Yeah, good. Lois says she loves her smile. Rachel says she loves her sense of humor. I love that I am bubbly and I love to give compliments. Y'all better come on.
There you go. There you go.
I love it. Well, I love my sense of humor. I love your sense of humor too, Chanel. It's one of my girls.
Nice, nice.
But I am so honored that we connected. Thank you for your time. Thank you for your knowledge. We had a lot of people in here today, and it's because this conversation was needed. So thank you for your yes. Thank you for your yes. And I think that we need to let's start trying to plan for next year. How we gonna run back? You know, this is my platform. We're either talking about mental health, self-care, self-love, spirituality, relationships, but it's all about self. And we can get people to live the best version of them.
Yes, yes.
We're gonna be in a good space. So thank you guys.
I'm all for it.
Yes, thank you guys for showing up. I'll drop this. I'll drop your information though in the chat. This is already connected to YouTube. I don't know how it works, so we got to go and check. I don't know. Did people be? Don't matter. We got it out. So
awesome.
I'm so happy. So thank you. Enjoy your family. Happy Thanksgiving.
Yes, happy Thanksgiving. Thank you, Erika, for allowing me to actually talk about this. Mental health is my passion. It's, you know, especially in the Black community, we don't know enough about it, and education is the biggest thing. So I appreciate you allowing me to be on here to talk about it. So now we got Wisconsin, Texas, and whoever else watches from there. Like, we're just doing a thing. So I appreciate it. So definitely a part two. We need a part two.
Yeah, we'll part two it up. So thank you guys so much, man. Everybody have a good Sunday. I'll talk to you soon.
All right, talk to you soon. Okay, thanks. Bye. Thanks, guys. Bye.